today will be all about knee replacements.
Discussing total knee replacement, I think it is first important to discuss how arthritis affects your knee and how that development makes your knee more painful and stiff over time. That way we can understand how to expect better pain relief with knee replacement surgery as we get rid of the arthritis and improve your function. In a knee without arthritis, you typically have a meniscus on each side of the knee. That is the shock absorber of the knee. You also have functional ligaments in the center of the knee, such as your ACL and your PCL, that provide stability. On the ends of the bone, you have a thick layer of cartilage on both the femur and the tibia. As arthritis develops, the space between the joint on each side will diminish, and typically that means that the meniscus has either been torn or is no longer providing the shock absorption, and the cartilage is wearing thin on each side of the knee. Secondary to that, you may have instability of your ligaments, such as the ACL or the lateral and medial collateral ligaments, and you may also develop bone spurs along the edges of the knee, which result in the knee being more stiff, as well as hard bone right beneath the surface as that meniscus and cartilage lose their shock absorbing capabilities. This is an example of a total knee replacement. By getting rid of the arthritis on the femur and the tibia, we're able to improve that knee's functionality by giving it smooth gliding motion now along this polyethylene plastic. Now, in order to put these components in appropriate position, we first have to shape your femur bone by taking a flat cut in the bottom of the bone and 4 extra cuts along the edges of the bone so that we can fit the replacement on just like a cap on the end of your bone. Now, on the tibial side of things, it's a flat cut on the top of the bone with a little hole in the center of the bone that we're able to fit the metal piece into your bone. This white piece here is the polyethylene plastic that provides the new cushion of your knee. So when compiled together, your knee now has a smooth gliding motion and no longer has to account for bone touching bone, such as you have with advanced arthritis. I often get asked, what is the difference in a partial versus a total knee replacement? What I've just shown you is a total knee replacement where the entire top of the tibia bone and bottom of the femur bone have been replaced with metal and with a plastic between the two. Now, in a partial knee replacement, since the arthritis only affects one part of the knee, we're able to leave the unaffected part of the knee alone and only make those same bony cuts along the side of the knee that's affected with arthritis. And from there, it's the same concept of replacing the end of the femur bone and the top of the tibia bone with metal and a strong polyethylene plastic between the two. In this surgery, the ACL is intact and is spared, as well as the other side of the knee, which has intact cartilage and meniscus. Another very common question that I get asked is, what are my implants made out of? Knee replacements are typically designed of a titanium alloy or a cobalt chromium alloy that allows for either cement bonding to the implant and to your bone, or has a surface that encourages your bone to grow into the implant. The same is true on the tibial side of things, which is typically a titanium-backed alloy with either a surface for cement to bond to both your implant and your bone, or a surface that allows your bone to grow into the implant. The polyethylene plastic is the cushion between the two metal pieces. In most designs, this is allowed to clip in and be taken out of the tibial base plate. This allows for the ability to change the sizes of this implant and to switch this out if there's ever issues in the future.
Thanks for watching. If you have any other questions, write them down and we'll talk about them in person.